Hi, this is Dr. Bob Dannenhoffer. We're going to get started in just a minute with our Christmas show. I'm here in my home, and so we'll give a few minutes and we'll get started right on Christmas. All right, I'm going to check out the sound and the camera. Unfortunately, you have to see me, but hopefully the sound is okay. All right. All right. Can you get it going on my phone too? With no sound on it? So I can read the questions. Yes. All right, it's 4 o'clock. Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. I'm seated in my living room in front of the roaring fire here, and we'll get going for Christmas. We're doing this without the help of our usual crack team, and so there might be some technical glitches, and if there are, please be kind. Anyway, we'll get started. Again, this is a chance for you to ask questions. I have the questions here in front of me. And so if you have questions, please do them, and I will try and answer them as best I can. Normally, we have someone who is actually writing down the questions and sorting the questions, so it makes it a little easier. We don't have somebody here doing that today, so it'll be a little bit harder. I see that we've already had a few people watching, so we'll get started. As always, we usually start at the top, how it's going in the world, and then move down to the local situation. Still an active pandemic in the world, although I am seeing a slightly lower number of cases this week. We always have to be cautious about cases during holiday weeks because during holiday weeks, sometimes people don't get tested, sometimes public health is closed down, and so we don't get reports as we might, and sometimes just things happen actually during this time, and we may not then be able to tell what's going on. But in the world, we're at 80 million cases, 1.75 million deaths. Cases and deaths in the world are still rising, although rising at a slower rate than they were in the last few weeks. The disease is still very active in the US, in Brazil, especially in the United Kingdom, Russia, Germany, and India and France. And India and France is going down, Germany is about stable, but in Brazil, UK, and Russia, it's really increasing. And UK is probably the most concerning because of the new virus variant they've reported in the last week, and we'll certainly talk about that more. In the US, we're at 19.2 million cases and 338,000 deaths. Early on, when they predicted how many deaths we would get at the end of the calendar year, the numbers range anywhere from 250 to 350. So we're at 338 now, and we may well be over 350. This is really a sad measure. When we look in the US, the disease is prominent everywhere in the US, especially in California, Florida, New York, Georgia, Illinois, and especially Tennessee. In the US, there are only a couple places that are not hard hit, and those would be Maine and Vermont, Hawaii, and Southern Oregon. So it really looks like this is a pretty prominent disease. Although when you look in the US, the number of cases is down this week, and I hope that's real. I hope that's just not an anomaly related to the holiday. You remember back at Thanksgiving, there was a drop in the Thanksgiving week, and the hope was that was a real drop. It turned out that rather than being a real drop, it was just an anomaly due to the holiday, but we can always hope. In Oregon, we're at 106,000 cases, 1,500 deaths. We are clearly past the peak in Oregon, but this disease is still really active, especially in the Portland area. So if you look at Portland, Multnomah County, Washington County, Clackamas County, they're really struggling with disease. And they have so many cases every day that they're not being able to do full contact tracing and full support for people with disease. In Douglas County, we're at 1,346 cases, 37 deaths. We have 11 new cases today, no new deaths, only 8 in the hospital. So this is clearly down from our peak. Our peak was really in the week of Thanksgiving and has come down since. And so we're really doing a pretty good job here of keeping it in control. We have no new big clusters. You remember in November we had 5 large clusters, each of which resulted in many cases. We've really not had that in December, and I think that's a big reason that we're down in the number of cases. Well, the big COVID news of the week is that these 2 mutant strains of the virus are really worrying us. So the first one is the B.1.1.7, which is in the UK. Originally, they thought it was many times more contagious, but it appears to be about 56% more contagious according to the recent study. Now, I will tell you, when you see those things come out soon after a new mutant is recognized, those are really hard. So when they say, 56% more contagious, it probably is more contagious. It's a little hard to know how much more. Those numbers usually overestimate, and those numbers then come down with time. But this is already a pretty contagious virus, so any more contagiousness is really a worry. And what happens is, when there's a less contagious variant and a more contagious variant, what happens is the more contagious variant just in the end tends to take over, and that would truly be a worry. We do not know if it's here yet in the United States. England and the UK do a very good job at looking at all of the viruses, and they're doing thousands of full genomes a week, so they're better able to spot mutants. In the United States, there's no national strategy to do this. There are a lot of small labs that are looking at viruses and mutant genomes, but the numbers are really quite small in comparison to the UK and other places. So these new mutants may be here, we just don't know about it yet. The other one is the 501.V variant, which is being seen in South Africa. That variant appears to be affecting young people more and maybe more virulent, but it's really hard to know. Again, these are relatively new, and we don't know if these are there yet. But the problem is that we could at some point get a mutant strain that now is going to be resistant to the vaccine. Now remember, the way the vaccine worked is that they pulled out a small part of the mRNA or the messenger RNA from this virus, and that's what they're using to do it. So if one of these mutants are in the same place that they pulled this genome from, it could definitely impact the way the virus works. So far, we don't think that's the case, but again, this is going to be a real concern. And mutations happen when there's a lot of disease circulating. When there's very little disease circulating, there's very little mutation. When there's a lot of disease circulating, there's a lot of mutation. And one of my biggest concerns is about the mutations stemming from mink farms. So mink are these little ferret-like creatures that live in huge farms, one in Oregon and many in Europe. And these mink live together in fairly close quarters and spread this mink among themselves. Now, it kills some, but certainly not all mink, which is usually the worst situation, because then there are a lot of sick mink who transmit the disease. And when mutations start, these mutations then can get propagated. These mutations can then go to the handlers and then to the people in the community. Now, we don't know the specific site of these mutations, but that really, really, really is a concern. Let's get to some questions. I'm going to have to read them off my phone. So it says, Karina says, when will community health nursing get the vaccine? So community health nursing, home health, visiting nurses, hospice, are considered to be in the 1A group. So we've already started with the 1A group, and we're hoping to get the 1A group worked on in December, and depending upon how fast vaccine gets, and we'll get there, be done by at least the first dose somewhere in January. So as soon as we know where this vaccine is coming and when it's coming, we'll be better able to go ahead and get the vaccine out to those community health nurses. We think community health nurses are incredibly important. They pose a special risk, home health and hospice, because they're going out to many people. And should they get infected, innocently or otherwise, then when they go to visit all of these people, they could expose lots and lots of sick people. So these workers who are in many places are among our highest risk healthcare workers, and those are the ones we're going to go and get the vaccine first. So as soon as we get it, we'll get there. We're going to talk a little bit later about what we know about the vaccine, when we expect it to arrive, and how we expect to do it. Essential employees from memory care homes, a very similar story. They are also considered to be high risk. I think people in memory care are especially at high risk. They tend to be older. It tends to be very, very hard to get them to enforce quarantine measures like wearing masks and staying in their rooms. So we really worry about memory care, and we would like to get both the people who are in memory care as well as their caregivers immunized just as soon as possible. So Christine, hi Christine, says Governor Brown is pushing for schools to reopen. Is this a foreseeable expectation for middle schools, or is this wait and see? Is the weekly infection rate still 3% to return to school? So a couple of things have happened over the last week. One is that now that we know a little bit more about the disease, the state has made the guidelines that were previously mandatory now advisory. So it'll be up to school boards to make that decision. In Oregon, school boards are pretty independent. They are really their own group that get to make their own decisions. Now, they tend to make decisions in conjunction with public health and in conjunction with ODE. But again, it's the school board that gets to make those decisions. The county commissioners have nothing to say about whether schools open or close, and public health has always been advisory. Now, advisory means, it's really not a good time to open schools. And when we've said that, schools have followed. When we said it looks like the disease is going down, it looks like it's safer, again, we've worked very carefully together. I meet with the superintendents each week on Wednesday morning at 10 o'clock, and we talk about what's going on. We talk about the disease. We talk about what diseases in what communities. And generally, we've had a really, really good relationship with them. Generally, when there are a lot of cases in the community, there'll be a lot of cases at school. And when there's a lot of cases at school, kids will be in school and out, because there'll be cases in the school. So what we need to do is bring the case rate down. When the case rate is over 200, there are going to be so many outbreaks in schools. In fact, we were having more than one a day when our case rate was more than 200. When the case rate is less than 100, and I think we'll get there soon, when the case rate is under 100, I think it'll be reasonably safe to start schools in person. Again, in grade levels, the younger grades are usually safer than the older grades, because the younger grades typically have one class that they're in. When you get to junior high and high school, there will be multiple classes, which add to the complexity of what goes on. In addition, we think kids, although they may have very high levels of virus, don't spread it as much as older kids. So we'll start off certainly with the K3, and then maybe move our way up. I do not know what the timing on that is going to be. The other issue is that kids in K3 find it especially hard to do online learning. When you're a high schooler, you can read books and listen to things and read things not during class period and then discuss them in class period. You really can't expect a second grader to read the material at home and come prepared to class to discuss. So we think especially for K3, K4, K5, it's really important for them to be in class. And again, we've not seen a lot of transmission in school. We've seen a lot of cases in school, but almost always we can find that those cases have not come from school, but they've come from the family, or they've come from a coworker or a spouse, and not come from another student or a teacher in school. In fact, we have no convincing evidence that there's been any transmission in school. Now, some would heartily disagree with me, and I can't say for sure. Now, people always say, well, how do you know where people got it from? We don't. I mean, except in the most obvious of cases, we have an educated guess, but it's at best an educated guess. I mean, you do not get a receipt when you get the disease, but when we see 5 people all at the same party, all sick, and the timing is correct, we assume that they got it at that party. Now, it is certainly possible that instead of getting it at that party on Sunday afternoon, you got it at the grocery store earlier on Sunday. And it certainly is possible. But again, we work with the likelihood, and the likelihood is that 4 other people who attended that afternoon party on Sunday were sick, that's probably where you got it from. Again, for the weekly infection rate, still 3%. There's not going to be a number. Again, with the lower positivity rates, That is, if you look at the tests we do, what percent are positive? As the positivity rates are lower, usually that means there's less disease circulating in the community. And with less disease circulating in the community, it is safer to restart schools. Our positivity rate has been 3 to 5% pretty much all through this pandemic. I mean, compare this to other states where it's 20 or 30 or 40%. When you have a 40% positivity rate, it means the disease is totally out of control. I don't think we've ever been really out of control in Douglas County, and that's good. Somebody says about specifically, and they talk about one nursing home again, the nursing homes are getting their vaccine through the Federal Pharmacy Partnership. I know they've already scheduled some. I do not know about every nursing home, but you can certainly check with every nursing home and see. So Laura says, if I'm allergic to a napsine, is it still safe to get the vaccine? In the vaccine, there's the mRNA particles, there are fat particles, there's polyethylene glycol. There is no napsine or any of the other things that are maybe in other vaccines. There's no mercury, there's no antibiotics, there's no egg particles. And thus, we do not think that unless you're allergic to one of those things in the vaccine, which would be very unlikely, that allergies to other things would be an issue. For example, Deborah says, what about latex? Again, latex is not thought to be a specific concern because there is no latex in this vaccine. However, if you have allergies to other things, I would just be sure that when you got the vaccine, the place you were getting the vaccine is set up to treat in case you would have an allergic reaction. To treat an allergic reaction is scary, but not very hard. It's an injection of epinephrine. It is Benadryl either orally or by injection, and maybe oxygen, and being able to call the ambulance to pick you up in case you don't respond quickly. Now, what happens most time in these allergic reactions, you give the person their EpiPen, and 2 minutes later, they're fine, and by the time the ambulance gets here, people are sitting around wondering why they're there. So again, that's what most of the reactions have been like. There was one reaction in Alaska that resulted in a hospitalization, but again, really low. Now, as somebody pointed out during this time that there were 6 people who had mild reactions, there are 90,000 people who got the disease. So it's a lot of disease out there, and I think the risk from this vaccine is certainly reasonable. So someone says if a person is says a person's diabetic and hypertensive, would they be considered high risk? And yes, they would. The list of high-risk conditions will be out sometime in early January, and you'll be able to see where you fit. Now, diabetes is a big variation. There are people who have mild, what we call pre-diabetes, who don't take any medications but are advised on diet and exercise, to people who have moderate diabetes, to people who have really severe diabetes with lots of secondary and organ damage. I don't know how Oregon is going to split those out, but there's a vaccine advisory group that's meeting on January the 4th to help iron those things out. So Leah says, how's Reedport doing? Well, Reedport, for those who have been watching all along, had a terrible time in November. They had a party that resulted in a lot of cases, and then we had a lot of secondary cases. And it was the secondary cases which affected a number of stores, a number of food establishments, the city government, the hospital, the nursing home, the clinic. And so it really was awful. But in the last week or so, their number of cases is really quite a bit down, and that is a good thing. And again, kudos to all of the people that we work with in Reedsport that have helped us with this. I will tell you, it really came as a shock to that community. It had very little disease before November to have that many cases. And I went over there several times and met with Paul, who's Paul Connolly from the hospital, met with the city administrator. And so really there was a lot of excellent work in Reedsport that helped to bring this down. Now, this has not happened everywhere. Now, there are places that start off with an outbreak like that and they continue to have a tremendous amount of disease ongoing. We didn't see that in Reedsport, and kudos to everybody in Reedsport. So Deborah says, how are people being notified as their turn to get the vaccine? Yeah, this is really one of the biggest problems. We're getting many calls a day for people to try and figure out when they are going to get their vaccine. And it's maddening that I can't give you a good answer. I mean, I would love to say that, if you're in this group, you can get your vaccine the third week in February, and this is where you can get it. The problem is the vaccine comes from the manufacturers to the feds, from the feds to the state, from the state to the county, and then from the county out to the people who are going to be delivering it. Turns out that even the state doesn't know when they're getting the vaccine, and the numbers are changing on a daily basis. And so we don't know. But as soon as we do know, we will let people know. So Carlos says, if you've had COVID, can you get it again? So just in the 10 minutes before I was doing this, I was watching a presentation from an epidemiologist, and it seems like having had COVID one time gives pretty good protection against getting it again. That protection seems to be best in the first 90 days after you've had COVID. We don't know how long it's going to last, but it does seem to last 90 days or even longer. And it's not absolute, because we do know of certain unusual cases where people have gotten it once, gotten all better, and gotten it again. And we know they've gotten it again because in some of those places where they actually look at the viral genome the first time and the second time were different. So we know this was a second infection. But the number of those cases is very small. We do have a couple of people in the county who got the disease, got better, and got it again. For example, there was one person who worked as a nurse back in New York in the early springtime, got it then, was better for months, and now got it again. And so we do know what happens, but it seems to be relatively uncommon. There are other diseases out there where you can get again. So you talk a lot about measles. It's really unlikely that you get measles twice, but for any of you who've had it, you can certainly get mumps twice. You can certainly get chickenpox twice. You can certainly get disease called roseola twice. And so there are many of these other viral diseases that you can get twice, although most people don't. Most people just get it once. And we think similarly with coronavirus, you'll get it once, and you probably won't get it again, but we can't be sure. The recommendation is you've had it once, you should still get the vaccine, although you might want to wait 90 days to get the vaccine because there are other people who've not had COVID before who are at higher risk than you, and they should get it first, and you might get it later. Yeah, so someone says, what about special education classes in high school? When should they be expected back in school? Well, again, we think special education is one of those things also that you can't do particularly well by Zoom. And because of that, we think that they probably should be back sooner. Now, special education poses a problem. Again, spacing in that group, wearing masks in that group is difficult. And many of the people who are in special education have other underlying health reasons. And because they have other underlying health reasons, that can be problematic. Yeah. So Misty says there was this story about an outbreak in Douglas County. That there was a story about big outbreaks, right? We had very few big outbreaks until November. And then in November, we had these big outbreaks. And some of the big outbreaks, we talked about Reedsport a little while ago. There were 2 in a nursing home. There was 1 at a church. There was 1 at a church gathering that caused lots of disease. And people wanted to know about that. And the Oregonian, Washington Post, CNN, all those people picked up on it. And they didn't get it exactly right. So what we're saying is that there were a bunch of these outbreaks, and in some of the outbreaks, we think that someone went to the place, the work or the other outbreak, while they were mildly ill, spread the disease, and then it led to lots of downstream effects. So we talked a little while ago about Reedsport, and the downstream effect of Reedsport was it started out at a party, but then spread to a bunch of businesses, the hospital, the nursing home at the hospital, the clinic, and it just causes a big mess. And the point of this was that if you go to work sick or go to a big party and it spreads, it has lots of downstream effect. What they picked up on was there was one of these outbreaks that in the end resulted in 7 deaths. Not that anybody who went to work themselves caused this, but sort of the chain reaction that then caused things down the line. I mean, we've used a lot of analogies about things like forest fires, right? And so there may be somebody who goes camping and there are then they don't put out their fire all the way and it starts a fire down the way and causes a lot of damage. Well, I mean, we all go camping, and we might all, any of us could have left our campground and not fully extinguished the fire. And while we're not trying to shame anyone or blame anyone, we do tell people that when you leave your campground, be really, really careful to be sure that it's cold enough to the touch. If you can run your hand through where the campfire is, it's not going to be hot enough to restart. Similarly, we're telling people if you're sick, don't go to work or school, because if you go to work or school, it can cause a lot of downstream issues. And that's the issue here. Not trying to blame anyone, not trying to shame anyone, but having people recognize that they need to be careful about not going to work, not going to school if they're sick. Now, somebody asked me about this before, and I said, well, look, in our society, we have not been particularly kind to people who take days off when they're sick, right? If you, a year ago, called and said, I've got a little bit of a cough and a cold, I don't think I'm going to come to work for a few days. There are people who might lose their job for this. There may be people who don't have days off. They would do it. And I say at school, we kind of encourage people to go to school, maybe when they're a little under the weather. As I said, we give out perfect attendance awards. We don't give out perfect infection control awards, right? What we should have is I didn't go to school when I was sick, so I didn't infect others. We don't give you an award for that, but we do give you an award if you went to school a couple of days with a cold or a cough or something like this and may have spread it to others. So we as a society have a little thinking to do. And during this time with COVID coming out, it can't be like regular times. It can't be like I was sick, coughing my brains out, but I went to work anyway. That's not a good thing, because it's so hard to pick out that little cold that you had from COVID. In fact, we had a case early in the week where somebody had a coughing episode that they thought was related to food going down the wrong way, and it turned out it was COVID, and they may have exposed others. Now, thankfully, I don't think they did, but that's what happens, and that's why you have to think a little differently during this time. Yes, so Christine says Roseburg School District is offering a special class time on Wednesdays for those who really need it. Space is limited. So, yeah, this is one of the troubles. Is that I'm doing pediatrics, so I get to talk to a bunch of kids every week, and I ask them how their school is going. Some is going great. They have all of the equipment they need. They've got good internet access. They have somebody at home who can help them with problems. They have somebody they can ask questions to, and they're doing okay. And then we have other families who don't. They live out in the boonies. They don't have much internet. They don't have somebody at home who can help them. Maybe both parents are working. And so it's a very variable situation. And we worry about inequality in school, that kids who come to school a little bit better prepared do far better than kids who are not well prepared. And we know during this time that it's further increasing that inequity. In addition, we do know that there are kids who get their good meal of the day as their meal at school because of food insecurity at school, at home, and then they go to school and they get maybe breakfast and lunch, maybe gets 800 or 900 calories in that day, so that if there's not a lot of food at home, they still get an adequate number of calories. And we know that during this time that may not be happening for all the kids. All right, let me go through a few other things here. So on the vaccines, there are two vaccines which have been approved. There's the Pfizer vaccine. The Pfizer vaccine is made by the U.S. company Pfizer, but actually itself, the vaccine was made by a company called BioNTech, which is a German firm working with Pfizer to make this. The U.S. got 100 million doses, and I understand we're getting another 100 million doses. That was the first vaccine approved. That's the vaccine that requires ultra cold storage. And that vaccine has already come to Oregon and has already been given out in Oregon. People want to know how many doses we have in each county and how many have been given. And actually, there is a website on the Oregon Health Authority. So if you go to Oregon Health Authority, go to the tracker. Under the tracker pulled out vaccinations, you can look day by day about how many vaccines were given and in what counties. So when I looked last, we had given 187 in Douglas County. Best I can tell, those were all given at Mercy. Now, we're supposed to find out Monday by midnight about what doses of the Moderna vaccine are going to come to the county and what doses of Moderna vaccine are going to come to public health. So we think early on that the hospital is going to get a bunch of the Pfizer doses. Public health is going to get a bunch of the Moderna doses. When public health gets a bunch of the Moderna doses, we're working with about 30 sites in Douglas County that are able to give the vaccine. On this Moderna vaccine, they're going to be giving it first to the 1A group, and that 1A group, again, is healthcare workers. Then there's this other group called the Federal Pharmacy Partnership that's getting given to people in nursing homes. So as soon as we know more, so since I'm supposed to know by Monday night, Tuesday at this time, I should better be able to tell you what's going to happen. Again, that's going to be pretty much the 1A group, which are going to be healthcare workers and people in nursing homes. Again, the sooner we can get through the 1A group, we can now get to the 1B group, which are going to be essential workers and people over the age of 75 who are not living in congregate care. We think there's probably about 2,000 of those in Douglas County, and then frontline essential workers. And again, it's going to be this other group that's meeting on the 4th of January that will tell us which essential workers will go early. So the feds just basically spelled out essential workers very broadly. This group that's meeting on the 4th is going to do that more, going to put a little bit more detail onto that. Let's see what we have here. All right, let me see if there's anything else here. All right, well, I don't see any more questions, so let's get done. How I wanted to end was thanking all the incredible people I get to work with. We're doing this today in front of my fireplace here, and this has been a fun way to do it. I've been able to answer these questions, but I can tell you that every day I do such a tiny fraction of the work that gets done. We have 35 people working at Douglas Public Health Network. We had 6 a year ago, and now up to 35. And these people are out there every day talking to people with the disease, delivering things. One of the lovely things they did this week is they said, well, it'd be pretty terrible to be isolated or quarantined during Christmas. Wouldn't it be nice if we could get pies for those people? So they arranged through Cruise Farms to go ahead and deliver pies to all of the families that were in quarantine. And again, this is not anything they had to do. This is nothing that they needed to do any differently, but it's just something that they wanted to do so they could reach out to those people. We've had people deliver meals. We've had people deliver other things. We had one where they delivered a thermostat at the people in the house. There was something wrong with the thermostat. So they went out, they got a thermostat and delivered the thermostat so these people could be warm during the time that they did this. They really have done a tremendous amount of work, and I really want to spend this time to thank them. In addition, we've had tremendous cooperation, absolute incredible cooperation. Now, I've been in town almost 31 years now and work with people around, and this town cooperates pretty well. But this has really shown how this area can communicate. The hospital, the doctors, the clinics, the county, EMS, the schools, fire departments, everybody has worked incredibly well together to make this work. And while I get to do this, and I'm sort of the face of what goes on, I can tell you I do a tiny fraction of the work. Really, the work is done by all those people who tend not to get very much credit, and sometimes they get crap for what they do. So some people are not kind on the phone, although most are. And these people are there every day at our call center taking calls. They're there every day tracking down new cases. In fact, even today. So even today, we're tracking down new cases. Even last night, I was on the phone with a lab from Chicago. Early this morning, I was again on the phone with this lab from Chicago, dealing with an issue. So these people are really working incredibly hard, including the 7 or 8 people from DPHN who are working today, investigating cases, doing contact tracing, still answering calls on our hotline, and delivering food. And so they're doing all these things, and I really wanted to end today by thanking all of the incredible people that have helped us with this. So again, we'll cut early. Please enjoy your family. Please enjoy your Christmas. And we'll do this again really next week. Bye-bye.